Member for Kamloops North Thompson.
Well, Mr. Speaker, I think it's very important. The minister wants accuracy. Let's get some actual accuracy going on this. On page 48 of the all-committee report, it says very clearly, they, as in all of the committee, they agreed that there must, not may, must be consideration of local needs and circumstances during the implementation of decriminalization. In this regard, members supported continuing consultation and support for municipalities. The simple fact is that support doesn't exist. The consultation hasn't existed to the level municipalities want. We're getting continued mixed messages from this government. This minister says it's health related, it has to have approval through health boards. The Minister of Municipal Affairs says, and I quote, local governments are elected by their constituents and their community. They know what is best for their communities. End quote. We can't get a straight answer out of this government. And they keep talking about everything other than open drug use in parks and playgrounds on things like crack and fentanyl and heroin. What the public wants, what mayors in Kelowna, New Westminster, other mayors and council around this province, is a simple province-wide ban around parks and playgrounds, and this government is refusing to allow that to happen. Parents simply want their 8-year-old to go play on a slide without needing the 8-year-old to be the drug intervention prevention officer, someone ODing with open drug use around that slide. That's what they want. They understand that Crab Park will not be enforced, that the tent encampment there will still see drug use in that park, but they want the tool to be able to try to enforce and move people along, help them get treatment when they are causing a problem around slides, around swings, around water parks. So when will this soft on crime premier listen to the communities instead of the Pivot Legal Society, actually bring in a province-wide ban on the open use of fentanyl, crack, heroin, and other hard drugs around our kids' playgrounds and beaches?
Minister.
Thank you, Honourable Speaker, and thank you to the member for the question. I would suggest, though, that the confusion perhaps is on that side of the House. The confusion is not with municipalities. Municipalities understand full well what their obligations are under the Public Health Act, and they routinely engage with health authorities and public health officials on with respect to public health matters. This is no different, and there is nothing in decriminalization that restricts the tools that municipalities have, and in fact, we are having ongoing discussions with municipalities in that regard. You know, the member raised the issue with respect to the Health Canada requirements for the decriminalization pilot project, and I will just note that Health Canada approved the exemption based on the submission that was made, and approved this pilot project. Having reviewed all of the actions that have been taken under all of the points, all of the requirements that they placed. So in regard to alternative measures and being able to direct individuals to health and social services supports, we have those supports in place. We have staff in place in order to direct and support individuals access healthcare support.
Let the minister.
We have ongoing consultation.
Let the minister conclude, please.
We have ongoing consultation, Honourable Speaker, with all of our partners, including municipalities. We have an unprecedented $1 billion investment in this budget, which follows on unprecedented investments in mental health and substance use in previous budgets to build out our system of treatment and care. And I could go on and on and on, and would be happy to review that list with members. But more importantly, Honourable Speaker, I think this is a time when we have an unrelenting crisis that impacts our communities in so many different and complicated ways that we need to work together. We really need to work together to change the dial on this issue, Honourable Speaker.
The bell ends the question period.